What are the different stages in terms of addiction? I will use alcohol as a kind of behavior which is bothering a person in terms of chemical dependency. It's not that you have not seen people drinking, but it is not that everybody who drinks becomes an alcoholic. It is for simple reason, and as I have in one of my earlier communication have said, that we all human beings are born hedonistics. That means we are all pleasure loving. Now, if you put in a graphical pattern a graph which is x-axis and y-axis, wherein pleasure and pain is being discussed, there is a concept called social drinking. Now, social drinking means what? Once in a while, some occasion, some party that people celebrate with use of substance. Now, there are many cultures and social events which takes place where people celebrate and drink, and the logic is that they are happy, not that they are unhappy, but they want more happiness. Now, this is again an addictive logic wherein the person is happy and needs little more happiness. Now, this is the category which comes under social consumption, that once in a while the person is using. The next step is habitual consumption. Now, when we say habitual consumption means what? I have seen patients who take 2 pegs or glass of wine or bottle of beer, and that happens every day. The question is that, is this person suffering? Will he seek help? No, he doesn't seek help, because it is a habitual. Like I will give you another example, that there are a lot of executive class of people, those who work really hard from Monday to Friday, but they wait for that Saturday to come where they can have a party in the evening. Will you call this person that he is suffering with an illness? No, probably not. But in reality, if you understand the next 2 steps, then you will think about it again. The next step is what we call compulsive drinking. Now, compulsive drinking means what? That, as I said, the social drinking, the person is happy, he wants to be more happy. So, therefore, he is drinking. But in habitual drinking, what is happening is that he is happy, he drinks, the graph goes up, but when he lands up into problems, like he went for a very nice party, he started drinking, and suddenly he puked, he vomited, or मुझे कुछ नहीं होता है and I am driving, he lands up in trouble. Like what we call driving under influence of alcohol, it's a legal crime. So he lands up in problems. Person who is habitual drinking, he starts with the pleasure and lands up into problems, variety of different problems, whether it is social embarrassment or legal issue or some kind of arguments with people whom he respects and loves. Now, this is what we call habitual consumption. From pleasure, in first step, it is from pleasure to pleasure. In next one, it is pleasure to pain. Now, in the third step, which I call compulsive drinking, is that stage where the person starts developing dependency, where it is a physical dependency and psychological dependency. Like a person drinking in the morning because he drank last night and he has got a hangover. Now, what the common belief system is that if I have 1 peg more, my hangover will go and I'll feel normal. So, a compulsive person who, when his intoxication is over, is in really bad shape. But the fact is that he doesn't start when he is happy and go into pain. He starts with the pain and drinks to feel normal. When that happens, there is a problem. The fact still remains that also look at the fourth step, which we call alcoholism. A person who is compulsive drinking will have issues related to his mind, his body, his relationships, everything. So, when we define addiction, I'm taking you one step backwards, that it is a chronic behavioral disorder clinically characterized by consumption of substance with inability to reduce or refrain. This might sound jargons, but it is. Attempting to do so, he will develop psychological and physiological discomfort, and the entire behavior is sufficient to cause impairment of his personal, interpersonal, social and spiritual life. Alcohol is one substance which affects every single part of the body, but the severity index can be very, very severe. A person who becomes from social to habitual to compulsive and then progresses to alcoholism. That means the person is only reducing his pain by drinking. And in spite of that, he doesn't want to do anything about it. The fact still remains, it's an illness, and I don't blame the person. The stages are chronic and progressive. Deterioration is chronic and progressive. Whether it is related to alcohol or any other substance or any other behavior. When it impairment of physical, mental, social and spiritual, we call it bankruptcy state. And that is the time, if he doesn't take care of himself, outcomes are very clear. The person either goes into unmanageable physical incapacitation, where his cognitive functions are fired, his memory blackouts which takes place, that under influence of alcohol, what he does next day, he doesn't even know what he has done. So when he doesn't know what he has done, he will start telling stories. It only means that it has started affecting his brains. Now these are the variety of stages wherein, again I am repeating, that it's a chronic progressive disorder leading to either loss of mental stability or death. Trust me, I have lost a lot of my patients. Sometimes I feel sad about losing a patient. I've seen hell of a lot number of patients who have suffered and who have died because of physical ailments, liver failures and cardiac issues and brain tissue disorders. However, I still say that alcoholics don't die, they suffer. It's pain. The journey we started with pleasure and increased pleasure results into reduction of pain to less pain and more pain again. So they don't die, they suffer, and ultimately all of us die, and so they do, but it's a really painful death. So these are the steps which, according to me, will definitely require a kind of help. The illness or disease of alcohol, when a person switches from social drinking to habitual drinking, the illness commenced. From social, habitual and compulsive drinking, and then a person going into a state where his mind, body and spirit, all of it is lost.